I wanted to start by telling the story of Sarah Bridges. She is one of my heroes, absolutely just an incredible person. And her story of advocacy and courage is just an example to me about challenging the status quo and knowing that you can truly make a difference in this world, as she has. Could already feel that I'm going to cry just talking about her. So, Sarah is a neuropsychologist who practices here in the Twin Cities area. She had a young child while she was studying for her PhD. She had Porter, who had received a vaccine and immediately developed severe autism. And, this was right after that legislation had passed that enacted the vaccine injury program through the federal government, and that basically prohibited anyone from pursuing litigation directly with drug companies for vaccine injuries. So, if you know about vaccine history, you're aware that this time period when pharmaceutical companies became immune from lawsuits, the childhood vaccine schedule started to explode, right? So that's definitely not a coincidence. So Sarah Bridges went through this vaccine court, which the federal government set up to try to help families who have been injured by vaccines. Basically, a way to try to not give families compensation and to try to control that and keep that away from pharmaceutical companies by denying as many cases as they probably can. Sarah won her case after I think it was like 8 years. And the federal government had acknowledged that her son's severe autism was directly as a result from the vaccination that he had received. And in his case, it was the pertussis vaccine. And her book, I would highly recommend it. It's called A Bad Reaction. And she details this whole ordeal in only a way, really, that a mother could. So during this time, I think it was around like 2005, RFK Jr. was sort of the biggest environmental justice champion in the world. He was fighting for stronger regulations to protect the environment. He was, pursuing all these various litigations, Monsanto case, which you are hopefully familiar with in terms of what he did there. And I explored that, the Monsanto papers, in another video if you're interested. He was really this big change agent also in cleaning up waterways and addressing water pollution. And Time magazine named him Hero of the Planet. So Sarah Bridges really identified him as this passionate guy who wanted to do the right thing and thought that he would be a good ally because nobody was listening to her or other moms talking about how their child's autism was caused by vaccines. So what Sarah did, she wasn't able to get in touch with him, but she did fly out to Cape Cod. She found his house, she rang his doorbell, and she gave RFK Jr. a stack of like 18 inches thick of studies and wanted to talk to him about that and about this possible connection between autism and vaccines. So he actually opened the door, invites her in, and they're sitting at his kitchen table, going through this, and he's listening to the story about her son Porter. So Sarah Bridges was actually a huge force in terms of, at this point, vaccine safety wasn't even on RFK Jr.'s radar. And he was actually very, you know, didn't really know much about that. And before Sarah Bridges approached him. And so it was really this interaction that spurred this curiosity from him that, as we know, really spurred this long time commitment to protecting children's health. So she was really the catalyst in that, which is incredible that there's that local connection here. So if you didn't know, the federal government has paid out settlements to families for vaccines causing autism, right? Like in Sarah Bridges' case. So you might be thinking, well, how can the federal government be compensating families through vaccine court? But at the same time, they are saying that there is no way that vaccines cause autism, right? So I want you to think about that. Think about, why is the federal government paying these families? And believe me, they try not to pay anybody. It is extremely rare to get any sort of compensation for these very severe vaccine injuries, but there are documented cases where they have done that. So I want you to think about that. How does that, is that giving you any cognitive dissonance right now? So I want to talk a little bit about our story and why vaccine safety is such an important commitment that our family has made, and that we want to really provide education on. So fast forward here, to our child, our son. It was right after Thanksgiving 2020. We lived in St. Paul. Just a quiet, uneventful day. He was totally fine. Didn't We were playing. He was going, 20 miles a minute, no issues. And then he woke up from a nap and he was so hot. And I was just like, oh geez, something bad is happening here. So I put him on my bed and I was going to go down to go get Tylenol and a thermometer. And that's when he had a grand mal seizure. And so I had worked on critical care units, so I understood, what that was happening. And he was still breathing. But he was not responsive at all. So ambulance took him to the emergency room, and they needed to use Ativan to stop his seizure. So we were at a local children's hospital for several days, and we basically were told he should go on Keppra, an anti-seizure medication. Uh, Very traumatic hospital stay for a young child, especially, trying to get them to do the testing and the EEG. It was just a very stressful experience. And then, later on, we did genetic testing, no cause identified, saw many, many providers, no cause. We have no idea what could have caused this, right? So put a pause on that seizure story. So now, you know, now we start noticing that our son's speech has regressed. He was learning how to talk, learning how to say words, and then really would only say mama and dada till he was about 3.5 years old. Sorry, this is just, it is an emotional thing to talk about. He began having these really epic meltdowns, really bizarre behaviors, severe stimming, aggression. Um, I want to protect his privacy too and not go too much into detail. But things were happening where, our lives as parents, it wasn't good. It was not good. He also went from, making smoothies with me every single day and eating so much, eating all these healthy foods, and then just did not eat anything and would only eat like 5 foods, which carried on for several years. And of course, we're told by everybody this is just a phase, but it takes longer for boys, to talk, and, don't worry. And the pediatrician was showing me this chart, and showing me, he's still gaining weight. So, we basically don't care what he's eating as long as he's in, the right percentile for what his height and weight should be. And I was just really concerned. That's kind of when I first started feeling concerned about some of the information I was being told, right? That, I have a physician telling me it doesn't matter what he's eating, which, I have a very basic, at that point, very basic understanding of metabolic health. I knew that that was mainly dictated by food. And so I was just very confused why she was telling me it was fine that my child was eating whatever. It didn't matter. Asking her, I was studying, the gut brain axis. I was studying probiotics, studying, herbs that could assist with mood and behavior, and just was totally dismissed about, everything. I was told I needed to see a therapist essentially to learn how to cope with having a child with autism. Um, so that's when I really started feeling like, okay, I'm really on this journey alone. Like, I have this child with disabilities, with severe behavioral dysregulation, and no physician, none of his specialists are helping me in any way. It was just an awful feeling, and that was really the hallmark of our lives for a long time. It took us years of advocating just to get our son weaned off of his Keppra, which, if you know anything about Keppra, it's a pretty heavy medication and can impact mood in adults and children. So, that was a stressful process. And we really felt like that was a victory when we were able to get him off of that after a lot of, geez, yeah, that's a whole nother video about that process. So it took a long time, thousands of dollars to do everything they wanted us to do to show it was safe for him to get off the medication. But then at the same time, the neurologist said he felt pretty confident Asher wouldn't have a seizure again and would outgrow, his epilepsy. But had no idea what caused the seizure, no clue, nothing genetic, but could assure us that he probably wouldn't have another seizure, which again did not make sense to me. So, everybody at this point is telling us therapy. You need to go to therapy. You should go to therapy. You should do play therapy with your child. You need to learn more about transitions, about how to help support your child. And, in my head, I'm like, great, but like, I am a therapist, right? Like, I have a clinical licensure that enables me to practice therapy. Granted, I am not a specialist in working with kids. Um, but my husband and I thought, okay, we already spent thousands of dollars on private pay for speech therapy, thousands of dollars for other things that our son needed. Did we really want to spend thousands of dollars for therapy? No, we didn't want to. And so we thought maybe we would use our money and put that into something else, maybe to try to help him, which is what we did, right? We started going to a functional integrative clinic, which basically was life changing to us. So that was a good decision on our part. Um, but yeah, just really hard. I know people don't want to make you feel bad, but when the focus is, you're doing something wrong, people are sending you tons of parenting videos, you are the one who is judged for your child's behaviors in any aspect with, friends, family. Uh, and that is a very difficult, challenging thing. And that's why, we really were isolated for a long time in our lives because of that. And that was extremely challenging. So I decided to go through my son's vaccine records. I had started studying environmental toxins. So that was just kind of a natural gateway to start looking at, vaccine safety. And, I wasn't out there like a witch hunt, like, oh, gee, these vaccines are awful. I believed in vaccines. I got my kids vaccinated when they were babies, no questions. I believed everything I was told. I had worked in hospitals the majority of my career, right? I was in the medical establishment. That was me. I was an advocate for vaccines, absolutely. So it was hard for me to look into that, but I'm so glad that I did, because looking at his vaccine history, the dates, and exactly which type of vaccine he received, how much vaccine, that is all such valuable information. And I learned that he was given a hepatitis A vaccine 10 days before his grand mal seizure, right? So I thought, oh, that's an interesting data point. So I was reading, I read the package inserts for all these vaccines. So I got to hepatitis A. I'm reading the package insert for the specific vaccine he was given. And I get to that section, I think it's like 6.2, where they talk about clinical trials. And it was just shocking to read that in the clinical trials that kids were reported as having these severe seizures, sometimes in cases 30 days post-vaccination. And none of that had been disclosed to me when I was getting my child vaccinated. None of these severe adverse health outcomes, and the causal relationship, none of that was disclosed to me. Would I have made a different decision? I don't know, but that informed consent process was non-existent. I can tell you that. So that was a pivotal moment in my life, because we had taken my son to a children's hospital. We had taken him to so many doctors and so many specialists, and he was right in the throes of his vaccine schedule. Look at the age of this kid. And none of these experts thought to check, if you know anything about vaccines, right, which I have been studying vaccines here for the past year pretty extensively. If you know anything about vaccines that children are getting, seizures are a common, feeling like I'm getting upset. They are a common adverse health reaction that children receive, right? So if I'm an expert working at a hospital and I see a little kid coming in with a first time seizure, why am I not thinking, I wonder if that kid just had a vaccination? Why don't we check his vaccine, right? Because that's part of the conditioning, right? Because vaccines are safe. Vaccine injuries are only 1 in a million. That's not true. Vaccine injuries are fairly common. And it is so negligent to me, and really shows me that there is not a lot of education or understanding about vaccines. Because if any of his physicians had actually read the vaccine insert like the inserts in the packages for vaccines, you would know, right? If you were treating a child with a first time seizure, ding, 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 light bulb, like it is, as you can see, I was very upset when I was just talking about that, right? Because after that experience, we had to put him on an anti-seizure medicine that was, I felt, very harmful to him. And that was a very challenging time in our lives. Wouldn't it have been great if anybody would have made that connection? It was awful discovering that truth. I cried the whole day. I felt horrible. I cried for a long time. I'm still crying just thinking about it, because I made a decision that, I can't say 100% that this is what caused the seizure. I can tell you I'm fairly confident, based on what I've discovered in the clinical trials and knowing that he got that shot 10 days after. yes, I'm very confident that that probably is what caused my son's seizure. But to have nobody, none of the experts even look at that or assess that, um, I lost a lot of faith in the medical system when I discovered that. And it was uh, very traumatizing and isolating experience because, you can't talk to people about this. God forbid, then they think you're crazy. They write you nasty messages. They, harass you. They stop talking to you. And so it was a very isolating thing. I had some very dear friends I could talk to about this, thankfully. But yeah, that was definitely a defining life moment, where I just felt so encouraged then, like, I need to continue learning and researching as much as I can about these childhood vaccines, which I have done, and I have learned a lot. That has been extremely shocking, and has changed my life. And I know that my life's work will include advocating for vaccine safety, and it always will. Um, so, whew, just a little breath. Okay. So, I think you can understand after sharing that story why vaccine safety is so close to my heart. I have this child with autism, ADHD, history of a grand mal seizure, and now, this autoimmune disease, which none of his specialists found. It was only when I went to that quack doctor, a functional integrative medicine physician who tested 100 biomarkers of his health and was like, hey, did you know that your child has an autoimmune disease? I wonder where he got that from. So, it's not really an anti vax movement. That's what the media describes it as, the media, which is largely funded by pharmaceutical companies. That's how they've described the movement. I think a lot of people, half the country describes it as the vaccine safety movement. That's really what it is. Even if you decide that you want to get vaccines for your kids, there's safer ways of doing that, right? That your doctors probably aren't going to tell you about. Like maybe only getting your child one vaccine per visit, spacing out the vaccines, giving the child more time in between shots, keeping a log of any adverse health reactions that the child may have received after a vaccination. So this idea of vaccine safety, it's all encompassing, even for kids who are getting vaccines. And I've been studying this very closely. I've done extensive research on all of the vaccines my children have received, including, why these drugs were developed. You should really look into the hepatitis B vaccine as to how that story of how it was developed, really for a specific adult population, and then how that actually uh, was marketed to children and is now given to children in their first or second day of life. Very interesting looking at that clinical study and knowing that the clinical study used to license that particular vaccine uh, monitored children for 5 days only after they received the vaccine, right? Pretty shocking. Pretty shocking. I mean, I could go on, and that's why I am going to make a lot of these videos. It is absolutely shocking, the information that I've discovered, but a lot of other people know about this. That's why there's a movement. That's why there has been a movement, right? Since really the late 80s, since pharmaceutical companies were granted immunity from this. Um, so I've read all the package inserts multiple times. I have read many vaccine safety books. I've listened to so many podcasts, reviewed scholarly literature and reviewing clinical trials for the licensing process of each vaccine. So I am extremely knowledgeable in this area, not because I want to be, but because I really have to be, right? It's because I need to be, because I have been failed by the medical system. I have been failed by our regulatory systems. I have been failed in many ways. And so it really is up to me. Nobody is going to do this research. They're going to tell me vaccines are safe and effective. That's the narrative. That's what they're going to tell me, even though the data really shows that is untrue in many, many cases.